Normal bladder function, both storage and voiding, requires normal communication between the brain, the spinal cord, and the bladder. Nerve signals from the brain and spinal cord to the bladder are transmitted by efferent nerve pathways. The efferent pathways innervate smooth muscles in the bladder, bladder outlet, and the pelvis. Efferent signals can stimulate the bladder to either empty or store urine. For an efferent nerve to excite the detrusor muscle via cholinergic receptors, it contracts and initiates voiding. Nerve signals from the bladder to the brain are transmitted by afferent nerve pathways via the spinal cord. Sensory receptors in the wall of the bladder send signals through the sacral nerves to the spinal cord and brain, which process and relay these signals to the efferent nerves. A specific type of afferent nerves, known as A-delta fibers, signal the brain and spinal cord when the bladder is filling. A different type of afferent nerves, known as C-fiber, are normally silent during bladder filling, but due to urgency symptoms in response to pain or infection, can trigger an involuntary voiding reflex. During normal filling, the urethral sphincter and pelvic floor muscles are contracted. With normal voiding, they become relaxed. One common cause of overactive bladder, or OAB, may be abnormal afferent nerve activity. For example, there may be a pathological emergence of abnormal C-fiber afferent nerve activity during otherwise normal bladder filling. Abnormal afferent nerve activity may be due to bladder irritation, recurrent infection, or unknown mechanisms. Abnormal C-fiber activity travels via sacral spinal nerves and activates efferent nerve pathways that stimulate the detrusor muscle to contract. This may contribute to the symptoms of OAB: urgency, frequency, and urge incontinence. Therefore, it is important to understand that the underlying cause of OAB in many patients may be abnormally active afferent nerve signaling rather than a muscular problem. Standard pharmacological therapy for OAB consists of administering anticholinergic medications. Inhibition of acetylcholine receptors, specifically muscarinic receptors, affects detrusor function and reduces OAB symptoms. Anticholinergics mainly treat the efferent limb of the micturition reflex, muscular activity. While anticholinergics may alleviate overactive bladder symptoms for some patients, they are not effective for everyone. Furthermore, some of these medications may cause intolerable side effects for patients. Researchers are currently investigating the degree and effect of these medications on afferent nerve signaling. Side effects such as dry mouth and constipation are common in patients taking anticholinergics. Sacral nerve stimulation may be an effective non-pharmacological treatment option for patients with overactive bladder who have not responded to or could not tolerate more conservative treatments, such as drugs. This minimally invasive procedure consists of positioning a lead near the S3 nerve root and connecting it to an implantable neurostimulator. Experts believe that sacral nerve stimulation's mechanism of action most likely involves modulation of afferent nerve activity. For example, sacral nerve stimulation may inhibit C-fiber afferent nerves. This may reduce the abnormal C-fiber signals transmitted to the spinal cord. In turn, this is believed to inhibit efferent nerve signals to the bladder and blocks involuntary reflex voiding. Therefore, sacral nerve stimulation appears to treat symptoms of overactive bladder due to abnormal afferent signaling and may be an effective treatment option for patients with overactive bladder who have not responded to or could not tolerate more conservative treatments, such as drugs.